Hi, I'm Liz. I'm one of the childbirth educators here at the University of Tennessee Medical Center. Unfortunately, due to the coronavirus outbreak, we have had to temporarily suspend our labor and delivery tours and childbirth classes. With that in mind, we wanted to provide you with a virtual tour of labor and delivery so you can see what to expect before you come to deliver your baby. When you arrive on campus, follow signs to labor and delivery. For patients in active labor, temporary parking is available at the flag circle entrance. Anyone entering the hospital at this time will receive a brief health screening. For assistance getting to labor and delivery, or if you need a wheelchair, stop at the reception desk to ask for help. After the screening, take the first bay of elevators to the right to the 3rd floor. Take a right off the elevator, continue to follow the signs to labor and delivery. To enter the unit, pick up the phone seen here and speak to the unit clerk. OB evaluation, or what we often refer to as triage, will be your first stop in labor and delivery. Here we can hook you up to monitors to assess your contractions, to see if your water's broken. We'll also look at your baby's heart rate. Nurses here will be in communication with your providers, and from there we'll come up with a plan for what our next steps will be. So these monitors will be placed on your abdomen. One goes up high to monitor the contractions, one goes a little bit lower, and that monitors your baby's heart rate. This line shows the baby's heart rate, and this line will show contractions. Every dark red line is 1 minute. So we can see here that contractions are 1 to 2 minutes apart. From triage, patients anticipating a normal delivery will be moved to one of our labor and delivery and recovery rooms. We really hope that you'll make this space your own. Special maternity beds allow you to move into different positions to assist with labor and delivery. With the press of a button, you are able to raise the head of the bed and also lower the feet. I'm able to raise the head and lower the feet. We have a thermostat on the wall. You're able to make the room more comfortable. We also have a couch that pulls out to make a bed for partners that are here with you. Every room has its own private bathroom. There's several lighting options to make yourself more comfortable. Under each side of the panel behind the bed, there's a black toggle switch, so you can just press that. That'll turn the overhead lights off. There's also a dimmer switch available on the wall for you to control the overhead lights there as well. You can also expect that we're going to continue to monitor your contractions and the baby's heart rate, much like we did in the triage room. For patients desiring more pain relief, we rely on our anesthesia department. This is an epidural pump. The anesthesiologist will place an epidural catheter in your back. Continuous medicine runs from the pump into your back to keep you comfortable until after your baby is born. Patients desiring a more natural delivery, or those that aren't ready for pain medication yet, might choose to use an exercise ball to alleviate some of their discomfort while they're in labor. If they want to, we can move on to a IV narcotic that would be available. You just need to talk to your nurse about that first. They'll communicate with the providers about what next steps are as far as getting you more comfortable. Babies are born in this room, and once they are born, they come up on mom's chest, where the baby will remain for an hour or so after delivery, and everything that we need to assess the baby will happen right there on mom's chest. So you'll have an opportunity to bond and to breastfeed and really be together as a family. And then once the baby is about an hour old, they'll move over to this warmer where we will finish up our assessment before we give the baby back to you. We are a rooming in facility, and we try not to separate healthy moms and babies. So baby will stay with mom pretty much in the room the entire time that you're here. If you have any special requests, any birth plan, anything that would be out of the ordinary for us, there is a dry erase board here in every room. There's 4 lines that say "Very good care means to me." That would be where you could put up any information that's out of the ordinary so that we would know what to expect and how to take care of you once you're here and admitted. After your baby is born, you'll recover in labor and delivery for 1 to 2 hours. You will then be moved to our postpartum unit just down the hall for the remainder of your stay. Patients requiring a cesarean delivery will be moved to an operating room down the hall in labor and delivery. We hope this tour has been helpful for you. For more information and the latest updates, please visit our website at utmedicalcenter.org. We look forward to seeing you soon.